So I did mention at one of the prior videos that I really don't like marketing terms like ponytail lift and so on and so forth. Unfortunately, in the world that we live in and the world of the internet, there are a certain number of terms that I do need to use in order to stay competitive, as well as explain what I'm doing to the patient. One of those terms is what I call a 3D facelift. The 3D facelift addresses the three primary categories of facial aging, which is structure, volume, skin quality. So a 3D facelift basically is a combination of procedures that addresses all three of these categories. So if Mary and Jane both show up to the office and get a 3D facelift, are their 3D facelifts the same? The answer to that is no. The 3D facelift basically states that we're going to address all three areas. However, one of the previous talks that I had done was the fact that in each of those categories, structural, volume, and skin quality, there's a bunch of procedures. And the selection of those procedures is based on the patient's individual concerns as well as the patient's anatomy. So a 3D facelift basically is just combining those three categories together. However, it's not just a one size fits every patient. It primarily is there to make sure that patients understand that their facial rejuvenation procedure is addressing these three large categories of facial rejuvenation. So that's exactly what a 3D facelift is. And I just wanted to define that, and I know that there's a little bit of hypocrisy in using a marketing term, but hopefully this has really defined this to the patient with respect to my idea, thought process, and the science behind it so that it makes logical sense.